think the principle of a 24/7 NHS is completely the right one, and many people would say that that's what we have at the moment. The principle of making sure that people who go into a hospital on a Sunday get exactly the same quality of care as you would on, say, a Tuesday morning is completely the right one. The problem with this whole dispute is the fact that the Health Secretary, Jeremy Hunt, is presenting the junior doctors contract as the key to unlocking more consistent services over 7 days of the week. And the truth is, to deliver that consistent quality of care that we all want to see, you need to change a huge number of things. And actually, the group of staff in the NHS who have to change their working patterns least in order to deliver that more consistent care is probably junior doctors, because they already work nights, they already work weekends, often working bank holidays as well. What you need to look at is the amount of consultant cover that you have in hospitals at weekends and overnights. You also need to look at things such as the number of nurses you have on wards in relation to the number of patients that you have there. And also there's a really interesting argument as to whether the people who go into hospital at the weekend are actually more poorly to start off with than the people who might go to hospital during the week. For example, a number of people find it very difficult to access palliative care when they're towards the end of their life at the weekend. So if during the weekday you might be going straight into a hospice, if you can't access that care at the weekend, of course you will go straight into the hospital. So this is a really complicated issue, and the Health Secretary is in real danger of oversimplifying this, and what he's done is conflated the need to reform the junior doctor contract with his manifesto commitment to deliver 7-day services.
OK, so if you agree with the principle, how should it be achieved, a 24/7 service?
Well, I think what needed to happen with the junior doctors contract was for people to come up with a negotiated...
I did let you have a 2-minute answer, and I am going to press you on the question this time, which is, if you think that 24/7 is the right way forward for the NHS, how should it be achieved?
You do need to reform the contracts, but you need to invest as well, because if you're going to spread resources more thinly, just over 7 days as opposed to 5, what you will see in all likelihood is a deterioration of the quality of care during the week. So the Health Secretary needs to be clear about the amount of investment that he will put in to make 7-day services happen. You also need to, for example, ensure that diagnostic testing staff are available at weekends, that you can pick up the phone to the council to organise social care on a 24/7 basis. So it's not as simple as just changing the junior doctor's contract. And the real problem with this whole dispute is that Jeremy Hunt will destroy morale in the NHS, which is already at rock bottom. He is risking a protracted period of industrial action. And we also might ultimately see the mass exodus of junior doctors from the NHS to countries such as Australia and New Zealand. And I think it's high time for the Health Secretary to stop acting like a recruiting sergeant for Australian hospitals and start behaving like the Secretary of State for our NHS.
I suppose it didn't help that Labour let all the consultants off the hook in 2003 when they changed the rules so that they didn't have to work at the weekend if they didn't want to.
If you look at the data, very few consultants actually choose to exercise their opt-out. But there is an important negotiation that is going on with the consultant contract at the moment, and it is critical to increase the amount of consultant cover that is available in hospitals and weekends. Again, the problem with what is happening today is that the imposition of the junior doctor contract, which the Health Secretary has announced, could have implications for the way in which those negotiations about reform of the consultant contract proceed. Because up until now, the BMA and government have been progressing reasonably well with those negotiations. But I know that consultants feel as strongly as junior doctors themselves about the impact of imposing a junior doctor's contract. And so the whole delivery of 7-day services, which is what the Health Secretary himself would say he is trying to achieve, this is put in jeopardy, in my view, by the decision to impose a junior doctor's contract today.
So Labour was wrong then to implement this 2003 consultants deal?
I think everyone agrees that the reform of the contract, some reform of the contract is needed. But as I say, I think the key point here is if you look at the number of consultants who actually exercise their opt-out on elective care, it's a very, very small number.
Interesting. I wonder how interested your party is in this, particularly your leader, given that he didn't even mention it in PMQs.
I think if anyone looks at the work that we've done in Parliament over the last few days and few months, it's very clear that the Labour Party is very, very interested in this issue. I raised an urgent question on Monday. The Secretary of State for Health decided not to turn up and dispatched one of his junior ministers instead to answer my questions.
Yeah, but
we secured an
just
opposition.
To go back to the question, your leader didn't mention it in Prime Minister's questions. Was there any particular reason why he didn't? Is it not important enough in his agenda at the moment?
I think that what Jeremy raised on Wednesday was an incredibly important issue for people across the whole country, and that's the scale of the housing crisis that exists.
He gets more than one question, though, doesn't he?
Sorry, what was that, Kay?
He gets more than one question, though, doesn't he?
He does indeed. He gets 6 questions. And I think that what Jeremy is always keen to do, if you watch Prime Minister's questions often, he will often have a theme to the questions that he asks. There have been a number of proposals with regard to housing, which are of huge concern to people. We know that home ownership is
absolutely,
at an all-time
but I mean,
low.
Heidi from Westminster must have been pretty peeved that he didn't mention the NHS, given that how high on the agenda it should be at the moment.
I think last week he asked 6 questions on the NHSK. He pressed the Prime Minister on the government's
yesterday
failure.
was when the junior doctors were on strike.
I think, Kay, to be honest, if you listen to what I've just said, the fact that we secured that urgent question on Monday, I've been in contact with the Health Secretary about this repeatedly. He's ignored my representations to him. I think Jeremy Corbyn is 100% committed to this issue. He and I both have supported the case that junior doctors have been putting and the cause that they have been fighting for, which is a contract that is both fair for doctors and safe for patients.
Would you be happy for one of your loved ones, Ms Alexander, to be admitted to the NHS at the weekend? Obviously not for urgent care, because we know that that is sensational, but what about for some sort of routine procedure that couldn't be done because they couldn't get palliative care, as you pointed out, elsewhere perhaps?
I would be happy for members of my family to access care in any of our hospitals really at the weekend, because I know that the staff of the NHS do an incredible job to provide high quality care. That's not to say that there aren't some problems in some hospitals which need urgent action, because there are, but I think the quality of care that is provided at the moment in hospitals is something that as a country we should be proud of. My concern, however, is that as the years go by in this Parliament, the huge pressures that exist upon hospitals will mean that that quality of care, we could start to see that deteriorate. And I think that what we need to ensure is that we have highly motivated, qualified people working in our hospitals to be providing that excellent care. In fact, you asked me whether I was...
As you know, 15% more likely to die if you are admitted at the weekend. So, as you say, we do need to improve on our 24/7 cover.
Which study was that you were quoting, Kay?
There's been 6, forgive me, 6 separate studies, haven't there, that the Health Secretary quoted not only in the House of Commons today, but over the last 7 days. Is he wrong?
There are a number of studies that look at the rate of mortality amongst people who are admitted to hospitals at the weekend. A 15% figure is not the one that I'm familiar with. One of the most recent reports I read was by Professor Nick Fremantle, co-authored by Bruce Keogh, and they didn't refer to a 15% figure. I think this research, though, is really complicated, because if you look at the research paper that I just mentioned, they also find that if you're an inpatient in hospital at the weekend on a Sunday, you're less likely to die than if you're an inpatient, I think it is, on a Wednesday. And so this is a hugely complicated picture. What we need to look at, and what there needs to be more research done on, is the cause of that excess mortality rate. And there is absolutely no evidence anywhere to suggest that a lack of junior doctor cover at the weekends causes that. And so I think we actually need to understand more about what is happening in our hospitals before we can devise solutions to address it. And I go back to the point that I made earlier. I think that actually the nurse to patient ratio at weekends and at night time is incredibly important. And I think the availability of staff so that tests and scans can be carried out is also incredibly important. So this is a complicated picture, but to suggest that if you simply change the junior doctor's contract, then you can improve the consistency of care throughout the week is disingenuous.
Good to talk to you. Thanks very much indeed for joining us. Hopefully you'll come back soon. Thank you.
Thanks very